Today, let's talk about strokes. Doctor, what exactly are strokes?
That usually happens when one of the best examples is because a highly stressful job. What happens is the blood flow of a main road getting completely blocked. If without having any bypass, the other side there will not be any traffic flowing. And then eventually whatever essential supplies that particular. But then who has the good collateral? We can't say. If the stroke is affecting the left side of the brain.
The left hemisphere controls the right part of the body, and is that true?
You could have asked me a little bit. Now, I mean, I'm so much into neurosurgical practice now. So the most recent ones are the ones will go first. There will be a significant subset of our population where we can actually prevent strokes. If you ask me, there are only two things which we can do to completely negate all the risk factors. What we saw with Puneet Rajkumar is exactly what happened. When this kind of thing happens, general perception of people is, see, when he was very good, very physically very good, very active, but still, he developed. So what's the point? Let us live our life.
The doctors do tell us that you have to reduce your stress. So people are kind of hearing that for everything. So
we have, according to our guidelines, there are specific time frame in which we can intervene to reverse the stroke. Other things can mimic stroke. Like say if you get a CT angio done and then you find that your blood vessels are normal, they're functioning well, that doesn't make you stroke proof. That's some kind of a misunderstanding in general population, that if you do a CT angio or get a heart checkup done, that kind of proves you, it makes you stroke proof or a heart attack proof. That is wrong.
So then I was like, why should then I get an angiogram? But then that's a good point that, Hey, welcome to the 4th episode of DoctoPod. DoctoPod is a series in which we have real doctors answering real questions. All right. So in the last 3 episodes, we had a little bit of an introduction. We spoke about the different good habits with respect to keeping your brain healthy, your spine healthy, and things like that. And in the last episode, we spoke about some serious stuff like coma and brain death and these things. And it's not that we want to get a lot morbid or anything. It's just that we want to have a little bit of knowledge about what works, what doesn't work, and things like that, right? So in this episode, let's start with something a little less dangerous than a coma, probably.
Yeah, but still it can lead you into coma. So anyway, let's cut to the chase, I guess.
No. We are going to keep our fingers crossed and then, believe that we're not going to get there. But so we have Dr. Krishna Chaitanya with us. He is a neurosurgeon. He's been practicing in Bangalore for quite a long time now, about 15 years is what you said? 15 running. And today, let's talk about strokes. Doctor, what exactly are strokes?
Yeah, stroke. So stroke is basically any abnormality in the blood flow to the brain. Just like what we have, we all know about heart attack. No? So stroke is something called as a brain attack. So when there's a obstruction to the blood flow going to the brain, it can be termed as a stroke. So because of the obstruction, there is a deficit developing, like say if the blood flow obstruction is due to a part of the brain which controls our hand and leg movement, then they'll have paralysis. Or if the obstruction is to the place where I'm talking right now. So if the blood flow is getting blocked there, I'll not be able to talk. So stroke is something like that. It is a collection of different symptoms which happen due to blockage in the blood flow to the brain.
Okay. And at times we hear that there are like massive stroke, and then there is something called as a transient attack and things like that. So what is a transient attack?
Yeah. So usually what happens is, as I told you before, that the stroke is basically, there is a problem in the blood flowing to the organ, right? So what's exactly happening is the blood flows in a tube, called a blood vessel. So the blood which goes into the organ is called an artery, which goes from the heart, it goes into the organ. And the blood which comes back from the organ is called a vein, which goes back into the heart.
Yeah.
So this artery is a muscular tube. It has a good, because it has to, tolerate the pulsation.
Yeah.
It has to tolerate the pulsation of the heart. So it will be usually muscular. Okay. So it has different layers. So one is a tunica, one innermost layer is called a tunica intima, and the middle layer is a muscular layer, and then you have an outer layer. Okay. So when there's an injury to the inner and the middle layer, okay, that usually happens when, due to a lot of reasons. One of the best examples is because highly stressful job. What happens is the blood flow keeps, the artery keeps coming, increasing in dimension and decreasing in dimension.
Okay.
So this fluctuations in increasing and decreasing dimension, what happens? Creates cracks in the intima, the innermost layer. And once there's a crack in the innermost layer, the blood has a tendency that wherever there's a crack, it has to clot.
Try to fix it, yeah.
It has to clot.
Yeah.
So similarly, even in the blood vessel, if there's a crack, the tendency is that it has to clot. So depending on how big or small the clot is, symptoms will vary. Okay. So if it is a smaller clot, then you'll have a transient ischemic attack, as we talked about. If it is a larger clot, it can lead to a massive stroke. Okay.
So is it something like a transient attack is because the blood flow has reduced, but not to the extent that it has completely killed the supply?
You're right.
And a massive one is where the supply is so bad that the tissues are not getting anything at all.
So usually, sometimes to make people understand, I usually give them an example of a main road getting completely blocked, if without having any bypass, this thing.
Okay.
So if the main road gets blocked, then the other side there will not be any traffic flowing.
Yeah.
And then eventually, whatever essential supplies that particular area has to get, that will be completely gone.
Yeah.
So, having said this, if the injury, what I'm talking about to the intima, is microscopic and keeps happening recurrent again and again, what happens eventually is that there will be scarring and other things happening there.
Okay.
And that will lead to deposition of fat and other cholesterol, bad cholesterol we talk about. And that will again lead to blockages, where the dimension, the cross-sectional area of that blood vessel will become less and less. Yeah. That will lead to chronic strokes as well.
Okay.
Yeah. But having said that, what happens is, as the cross-sectional area keeps coming down, naturally there is a process which happens where there are dormant channels which are there in our body, where once this gets start blocking, the bypass channels start coming, and then that's called as collateral circulation.
So it's basically like when the metro construction is going on, there are diversions, and then people take those diversions and try to avoid the traffic blocks.
So in the chronic situation, what happens is, even though the main artery can keep getting blocked, if the person has a good collateral circulation, then he can more or less lead a normal life.
Got it.
Yeah. But then who has the good collateral, we can't say. Some people have a tendency to have good collateral, some people don't have.
Oh, okay.
Yeah.
Right. So now, what can stroke lead to? Typically, what have you seen in your experience? What are the things that stroke can lead to?
Yeah. So the most common thing which a stroke will lead to is definitely, as I told you before, that a particular part of the brain function is affected. So the most common thing which gets affected is that the movement of the hand and leg is lost. Okay. And if the stroke is affecting the left side of the brain, then even the language functions, that inability to talk or comprehend what you're talking, can also happen. So the most common thing what we see is paralysis of the one side of the upper limb and the lower limb.
Okay.
Along with inability to talk or comprehend what is happening. So this is the common scenario what we see in stroke.
So you said left is the hemisphere that controls speech and language
understanding, comprehension of language.
So we have also heard that it's like the left hemisphere controls the right part of the body, and is that true?
Anatomically, our mind and our brain is made like that. Okay. Where we have the majority of the fibers, the nerve fibers, they crisscross
Okay.
at the level of your medulla.
Okay.
Medulla oblongata, they call it. So there they get crisscrossed, and 80 to 85% of the fibers, they go to the other side, and then 15 to 20% of them still go on the same side.
Okay.
So that kind of evolutionary.
Yeah, I was about to ask that. Why? Any hypothesis at least on why that has happened?
You could have asked me a little bit. Now, I mean, I'm so much into neurosurgical practice now that I've forgotten my physiology. But yeah, see, like any end system, we will need some redundancy, right?
Okay.
So that is the reason why it has. I'll come to this scenario. So, for example, now if we take our eye for that matter. It will take in information from what you call this half of the, like the retina is like this concave. Yeah. So this part of the retina, okay, will only be able to access this half of the vision, side, yeah. Right? And this one will be able to access this thing. So there is some amount of disparity. Okay, it's not always homogeneous. So that's the reason why there are lots of decussations happening in the brain. Decussation means crisscrossing of nerve fibers happening in the brain. Okay. And eventually what's happening, the right and left part of the brain were connected very extensively by fibers. Okay.
So this is not just with the humans, it's with many
with all animals.
Oh, all animals.
All animals as in all
whoever have a brain. Yeah.
Yes. As in vertebrates. You can talk vertebrates.
Yeah, vertebrates. Okay. So at some point then maybe it was like, while evolving, the ones that had that crisscross, because of some DNA changes, that might have gotten favored.
Yeah, definitely. Yes. And obviously, the redundancy helps, right? See, for example, even if you have a stroke, okay, like as we had a stroke and the left side is blocked.
Yeah.
But still, he'll be able to walk and he'll be able to do his regular, more or less, some amount of activity, because there is some. One side, the other side, that 15% of fibers will still be able to give some function
of it. Yeah. Okay. So it's just that the one side will become extremely weakened, but not completely dysfunctional.
Correct. Okay. That's the thing. And in general, I mean, this is a little bit again into the evolution thing. The most recent brain which we have, the most recent brain which has evolved in us, always support the extensor movements of the body. Extensor movements means when you're reaching out to something. So I have to extend my fingers to reach out to something. I can't reach out to something by folding my hand.
Right. Yeah.
Okay. Yeah. So I have to extend my elbow to reach out to something. Okay. So what's happening here is that the brain has a lot of space and lot of nerve fibers reserved for these extensor movements, because extensor movements are the ones which help in foraging, help in hunting, help in activity, help in the livelihood of the animal.
Okay.
That is the reason why extensor movements are given so much of priority than the flexor movements. Flexor movements are these. Okay.
Any inward movement.
Correct. So in a stroke, the extensor movements are the ones which get affected more, because they are the ones which have been the most recent. So the most recent ones are the ones will go first, and the more primitive ones will have more redundancies in the system
by design.
By design.
Yeah.
So the flexor movements and the walking movements are all very redundant. They'll have lot of sub layers inside, whereas the extensor movement will not have that many sub layers.
Okay.
So that's a little bit of neurophysiology.
Yeah. So this is why they say, right? In our schools, they might have taught different subjects in different classes, and we might have had different notebooks and stuff like that. But ultimately, they're all connected. So it's not that you have to compartmentalize things in that way. Such. Okay, great. Now, so strokes, can we prevent them?
Absolutely, we can prevent them. I mean, there will be a significant subset of our population where we can actually prevent strokes. Okay. Having said that, genetic influence is very significant there. Yeah. But we can still, even if we have a genetic predisposition for a stroke or a heart attack, we can still, prevent these things. In this thing of prevention, a lot of doctors and even a lot of as elite celebrities, they talk about prevention and all that, and we in blanket we talk about prevention and controlling about BP and controlling sugar and controlling this and that. If you ask me, there are only two things which we can do to actually completely negate all the risk factors.
Yeah. Okay. 80-20. 20% of effort, 80% of effect. Yeah.
So, one is obviate stress in your life. Okay. In that, I'm very specific: mental stress. Okay. And then second is inculcate physical activity. Okay. If you ask me, in this, the mental stress part is much more important than the physical activity obviously also is important. But if you do if you keep mental stress in the context of physical activity, that again is not good. What we saw with Puneet Rajkumar is exactly what happened. He had severe stress, as in he had a late night party. I mean, what we heard from the news, that he had a late night party, and then at 2 o'clock he comes in, and then he gets up at 5, and he has hardly any sleep, and then he goes to, intense physical activity, and there the physical personal trainer, not knowing, what was his, what happened, he didn't take a proper sleep and all that. He gave him very intense activity. See what happens. Right. So now, when this kind of thing happens, general perception of people is, see, even he was very good, very physically very good, very active, but still, he developed. So what's the point? Let us live our life. Wrong. No. Let's see here, what's happening is, one thing is he had a genetic predisposition. Okay, his father had heart attack and all those things.
Oh, I see. Okay.
His brother had a stroke. Okay. So then he was definitely predisposed for that. Okay. But in the context of that, what was happening was, he was leading a very highly stressful, as in he was trying to make everything meet, attend a party to, satisfy somebody, and then do his cinema and this and then exercise. So that's where he was not able to cope up with that kind of, and his body was not able to cope with that, and he developed that problem. Okay. So that is the reason why I said obviating mental stress is very important, because eventually the brain will be able to release, and it will release hormones. Okay, because eventually all the main ordering centers are there in the brain, which will either create destructive negative hormones. That is, we have talked about that flight and fight response, where you have catabolic hormones being released, or good hormones being released. See, both are necessary, but chronic catabolic hormones, in the chronic stress, always you're in a state of stress, will lead to lack of proper repairing happening in the body, and that will lead to a situation where you will predispose to strokes and heart attacks.
So I think this was in the second episode that we spoke about, how the brain cleanses itself when you're sleeping. But then when we talk about these things, in a lot of situations, the doctors do tell us that you have to reduce your stress. So people are kind of hearing that for everything. So could you please explain a little bit more as to why exactly stress causes or contributes to this at a great extent?
So I think for me, because I also went through this process of trying to understand, because whenever you are doing your medical field and degree and post-graduation, you never actually introspect and trying to understand what exactly you mean by a stress, what exactly you mean by. So when you start ruminating on these ideas with the information you have, then I came to understanding that whenever we have a tendency to try to control situations, right? A stress can be as trivial as inability to control your son or daughter. Okay. Right? Like, say, if obviously they are very, lively and jumping around.
Kids, yeah.
Yeah. And then if you are not able to enjoy that, rather getting irritated by that, that is stress. Because what's happening there is, because of the irritation, your blood pressure is increasing. So automatically your adrenaline and all those are increasing. That is increasing your blood pressure. So by increasing the blood pressure, what's happening? The blood flow inside is speeding up, and the blood flow speeding up will lead to we spoke in the first episode, laminar flow becoming turbulent flow. Turbulent flow will lead on to injury to the the wall, and the injury will lead to ulcers and clots, and then so the whole cascade will keep happening. And if the more you keep doing, the more you're in this kind of a psychology or a personality, the more you are predisposed to that. Okay. So the personalities are always, at the press of a button, they get outraged or anxious, or they get enraged by small things. They're not calm, and unlike you have this type A and type B person you talk about, right? So the person who's like that will definitely have a more predisposition of all these things.
Okay, but that's not to say that people who do enjoy things are necessarily better at it. It's just that we have to see if they are stressed in other ways. Yeah.
Exactly. I mean, stressed in other ways. So see, enjoyment can be anything. Yeah. Now you may at the outset, like, just to avoid the stress which you're already you're feeling, you may say, okay, let's have a alcohol or cigarette, and people may think that you're actually enjoying, but then actually you were stressed. Correct. And then you're trying to just beat it with this.
Correct. Yeah, you're taking basically a shorter way to it.
That's so. I guess the most important thing, if you ask me, is mental stress, avoiding that, and the second important thing is exercise. Okay, and then obviously the third is you need to relax. So the mental stress, in fact, is both are combined in the sense. Relaxation is important to lessen mental stress as well. Yeah. So lack of proper sleep, hydration, obviously these are most important things if you ask me.
So this is why the basic good habits, if you're following them, you're avoiding a lot of these issues. Yes. And I'm guilty of this as well. I mean, I'm not like, I'm in no position to preach anybody, because I also have my own stressors.
Everybody is. In the sense, we all have a threshold, So even probably the biggest meditator, even probably Buddha, would have had a threshold. Yeah, but definitely. Probably his threshold would have been very, very high to get stressed out. Correct. Got it. So, probably for another person who's, in a much more whatever, but they may have a lesser threshold. Like say, I shouldn't be giving the example, but we always say in the traffic, when you see we say bump into somebody, or say auto, or taxi.
Not even necessary. You're sitting there and then some squid goes inside.
So the threshold for engaging into a combative thing is very less. So that means they're unnecessarily predisposing themselves to unnecessary, hypertension, unnecessary raise of BP, which will lead on to problems like this. And we have seen that now. I think in paper it is nowadays coming that the bus driver suddenly is driving and then he just had a heart attack and he's just died. And just to save the kids, he just tries to park the bus to the side and then he just dies. I think 2 or 3 incidents happened just recently, last month. BMW. Similar thing happened even in auto drivers as well. So imagine even your threshold to combat, threshold to taking the stress if it is high. That means that you are okay with things going bad. You're okay with not able to control things. Then your body is not responding to the bad influence. You're not reacting. You're not reacting to the stimulus and causing unnecessary fight or flight response in you all the time.
Okay.
So if you're not doing that, then you're always decent, good BP, good sugar, good everything. Understand? So now you tell me whether the risk factor is diabetes, hypertension, stress, or it is stress. It is stress. It's only stress first.
Stress first, and then it kind of
and then you exercise. These 3 things if you do.
Yeah, because stress ultimately also ends up causing hypertension. It causes blood sugar levels. So we can't term those things as the cause. The cause is more
basal. Yeah, more basic. Exactly.
Okay. Now, you mentioned fight or flight. I had the situation once when I was in college. That day I had some exam. I remember I was reading my notes. It was a very quiet residential locality. So I was okay to open up the notes and read. And I was walking like very much on the side of the road. Something happened suddenly. And the next thing I know, I can smell dust. And I feel that I'm like lying on the ground. that's when it was Chennai. It was morning walk time, so a lot of people gathered around, and then they tried to help me up and stuff like that. And they said that the auto had hit me. Okay, and I flipped a couple of times and then fell down on the road. I have no memory of flipping or anything like that. I don't even have the memory of being hit. Okay, what might have happened there?
Yeah. So
Like why? Yeah.
So what has happened is when a memory forms when you process the information which is coming in from your senses.
Yeah.
Okay. So the processing obviously happens at a chemical level. So when there is a sudden change in your inertial frame, in the sense when you are walking or you are standing, whatever, and then your auto or some other vehicle has come and hit you, suddenly there is a sudden change in your velocity. So because of that, the sudden change, what happened is there is a disturbance. There is a, the disturbance happens in the at a cellular level and at the nerve fiber level. Okay. There is a transient disturbance in the metabolic functions because of that. Okay. Because of that, the processing doesn't happen.
Okay.
Understand. So, why? Because again, the same thing. Because sudden movement happening, there's a chemical shift will happen even in the brain cells also. So the sudden shift happening will not let the processing happen immediately. So that's why it takes a little bit of time, maybe a minute or 5 minutes or so, for it to again get back to normalcy. That is called as a concussion. Okay. It's usually whatever you felt. It's called in common parlance concussion. But what I told us is the inside cellular or biochemical thing what happens inside basically. Okay. That happens because of sudden change in the inertial.
So it was not like my brain trying to block something.
Brain not trying to block because brain is not able to process basically.
Okay. That's the reason. Okay. So this happened even before the brain could process what happened. Exactly. It's not trying to block anything voluntarily. Right. So doctor, we spoke about what a stroke is, what leads to the stroke. How do we identify that there is, of course there is that part about fast, and every hospital has that, right? Like you have to look for, the face.
Facial drooping.
And drooping, yeah. And then there is the arms, I think, slurred speech, and weakness of the arms, slurred speech, and but there is something for the T also. So, but time, yeah. So there is we know that, but then how do we know that it is not anything else? So how do you as a doctor figure out that it's a stroke?
Yeah, so the Be Fast, all those acronyms are the ones for identifying that there is a stroke. Probably it is a stroke. And then all those things are for the person or the patient to immediately be moved to a stroke capable hospital.
Okay.
So the first thing here
also not all hospitals are stroke capable. Yes.
Okay. So the first thing what I want to stress is here that not all hospitals are stroke capable, in the sense to treat the stroke rather. So what exactly makes a hospital stroke capable? Obviously that you need to have those consultants on board, like who will take, so neurologists, neurosurgeons have to be there. That's one. That doesn't mean that physicians can't treat it. They can treat it. But having said that, the limitation of treatment is only as much for the physician. Right. Neurologist, neurosurgeon can go to the next level of treatment. Right. That is one. And then to reverse, sometimes what we can do is if the person comes in a window period.
What is that window period?
So that means to say that when you have a blood flow blockage, okay, so the brain, the tissue will tolerate some amount of time before which the necessary oxygen or glucose have to be given back to it so that it can function normally. Yeah. Say you consider it like a starvation rather. Okay. So now we can, without food or without say without water or without oxygen, we can tolerate like some very good swimmers can tolerate 8 minutes without oxygen, right? Okay. So that means body itself is able to support. Yeah. So similarly, when blood flow to that particular organ is stopped, every organ has a set amount of time beyond which the damage sets in. Okay. So in brain, the brain being very highly metabolic, in the sense it has a high amount of energy necessity. I think as we discussed before, that the brain cell needs 32 ATP of energy unit, whereas other cells don't require that much.
Yeah, okay.
Okay, I'm sorry, not 32, but it has more demand rather.
There's somewhere I heard that 20% of our total energy expenditure is in the brain.
So that is the reason why, since it needs so much of energy, its primary preferential molecule is glucose. Glucose. So why? Because glucose gives 32 ATP, whereas the byproduct of the fat metabolism, that is the ketone, gives you around 8 ATP. So that is the reason why it needs glucose as a primary supporter of fuel, primary fuel this thing, rather than ketone, because it gives you per unit, per molecule of glucose, it gives you more ATP.
Right. Or per cycle, because fats are bigger, right?
No, fats are bigger, but the bigger fat doesn't get metabolized in the cell.
In a single.
The fat gets broken down into its byproducts, and then finally the ketone is a molecule which gets metabolized as a product of fat metabolism. Okay. But when it comes to carbohydrate metabolism, glucose is the most basic. This thing, it goes through the citric acid cycle, and then that gives you much more, and then that needs oxygen as a necessary this thing to do the respiration happening there. That's called aerobic respiration, and that gives you 32 ATP. And that's the reason why, since it gives more energy, and since the demand of the brain is more, it requires, it needs that glucose for that. So having said that, since it's so highly metabolic, if it doesn't get a constant supply of glucose and oxygen, because it needs oxygen for the aerobic respiration, it starts getting damaged. I think as we already discussed about the membrane stabilizing necessity for the brain.
Yeah, second episode.
Yeah. So because of that, it needs constant supply of the glucose and oxygen. So because of that, within minutes, the brain can start showing damage. Again, provided, as I told, we were discussing earlier, that if the collateral circulation is good, then whatever stroke happens, sometimes it limits itself to a small area. But if the collateral circulation is not good, then you can land up into a massive stroke. Okay. So that is the reason why we have created guidelines in which we can say that the window period, that is a golden hour. So the first hour is the supposedly called as a golden hour, where we can reverse the symptoms of stroke by reversing the damage which is caused. Okay. So say, for example, the membrane is just about to tear because the sodium potassium channels are getting dysfunctional. So, but it is not yet torn. So that probably is in a state where it is like already, say, 25 minutes post the stroke. So now if you release the clot, immediately again the blood will start flowing, the oxygen and the glucose kicks in, and then the metabolism, the aerobic response starts, and then again the membrane can get back to its normal position. But the membrane completely gets separated, and then the intracellular products come out. Then that is an irreparable damage to that particular cell. So that's why that window period is that. So we have, according to our guidelines, there are specific what you call time frame in which we can intervene to reverse the stroke. Okay, so that depends. So usually it is around 6 hours we have kept for one particular stroke. Then we have 24 hours for another particular stroke. So like that we have different time frames in which we can reverse the stroke.
Okay. But it is still better to get to the hospital within the first hour.
A stroke capable hospital in the first hour, as soon as possible, you can come so that we can start the necessary interventions.
Okay. How do you detect a stroke?
So obviously first is the symptoms. So since the stroke can, the other things can mimic stroke, like say hypoglycemia. That also is a very common mimicker of stroke.
Hypoglycemia is
as in low blood sugars.
okay. Typical with diabetes patients, right?
So we need to do something called as an MRI. Okay. So in MRI, you can see which areas of the of the brain are not able to not getting the proper blood supply. Okay. So MRI is an essential investigational tool. Before that, sometimes if the facility of MRI isn't there, then we can immediately get a CT scan done. In that we can still see there is a stroke or not. Okay, we can see the blood clot lying in the blood vessel. Okay, and then that itself we can trigger our so-called treatment. We can start triggering. Okay. So MRI, if it is there, it's a must. You have to do it first go. If it isn't there, CT scan still will help in finding out whether stroke is there.
Yeah, but first preference always is MRI because there is less risk of.
No.
Okay.
It's not about the risk. It's about the amount of information we get in with an MRI is much more than a CT scan.
Okay, but then the CT also has the downside of radiation also.
Yeah, right? But then in a situation of emergency, we don't bother much about radiation and all that. Yeah.
Right, and so if there is a stroke kind of symptom detected, so now fast, I actually literally could not remember the full form of that. So can you tell us what exactly should we look for?
No, I guess depending on stroke, we have two sets of circulations to the brain. Okay, we usually very vaguely differentiate from anterior circulation. That is the front part, and then the posterior circulation. Okay. So anterior circulation, if you ask me, that there are 4 blood vessels which are supplying the brain. Okay. 2 larger blood vessels which are coming from the throat. Okay. They are called the carotid arteries. And then there are 2 smaller ones which are coming from your spine. I see. Okay, that's called the vertebral arteries. Oh. Okay, so vertebral arteries. Yeah. So that these 2 vertebral arteries join together to form one single artery. And then these 2 front carotid arteries, they also go in. And they all form a communion. They form a ring around in the brain. It's like a ring road rather. So why you have a ring is because if one also gets blocked, still the blood supply can come from other areas to supply that area. That's why you have that redundancy. So that will we have a fancy name for that called circle of Willis, because apparently Willis saw that first or whatever. So. And then from that circle of Willis, you have these main arteries. They are going to the front part. Okay, you have 2 blood vessels for that called anterior cerebral artery, then middle cerebral, and you have posterior cerebral. So then from the back, those 2 vertebrae join together, and then they supply the back portion of the brain. So the front portion of the brain, obviously, you get symptoms of facial drooping. Okay, as I told you initially, if the right facial drooping is there, that means the left side of the brain is stroked. Similarly, if the left is there, it's the right one. And then you'll have arm weakness. So again, the F and A is now you are able to get, right? Yeah. So, and then speech, slurring of speech, that is the S. Okay. And then the time, whatever. And then if it is a posterior circulation thing, then you will be in altered sensor, because your posterior circulation goes right to your most primitive part of the brain. That's called the brain stem. The brain stem is the most primitive part of the brain. That means it has all the reflexive parts. I was telling, the most redundant steps, all that's there. Along with that, the main nuclei, okay, where the consciousness, we talk about consciousness, right? So I think we also spoke about reticular activating system in the last time. So those centers are there. So consciousness gets affected first in strokes which are from behind the posterior parts. So these are the different things we need to look in.
So in case of stroke in the posterior arteries, people would just lose consciousness.
Yeah, they may may have a vomiting episode, and then they may lose consciousness, or again they may also develop paralysis of the limbs, because all those fibers, they eventually come down from the brainstem. So even that also can be there. So
so if we notice any of these things, and secondly, if there is a predisposition, which is if there is a family history of something like this, then it is important that we immediately go find a neuro-capable hospital or stroke-capable hospital, and then
we can start the treatment for that, so that we can reverse it as much as possible.
Now, we spoke about paralysis. And this might sound like a stupid question, but what exactly is paralysis?
Paralysis in the most generic, the definition per se, it means that the loss of movement, rather, loss of motor power. So a limb is made to, its property is to move or walk or, forage, use its thing. So that is lost. So the movement is lost. So paralysis is basically a loss of movement, loss of motor power.
Okay.
So that's the definition. But the paralysis can happen in stroke. Paralysis, as I told before, wherever from the brain till the peripheral nerves. Okay, anywhere if there is a disconnection or an abnormality which is affecting the signaling of the nerve, then the paralysis can start. In the sense the muscle can't contract and then you cannot use that particular limb. So paralysis is a more general word where it means basically that there is no movement of that particular limb.
So when the brain is affected because of a stroke or something, is it only the motor part that gets affected, or is there a way, or is there a possibility that there could be organ damage and stuff like that, or does it not work like that?
Organ damage as in, I was not able to understand.
So the nerves are still going to other parts of the body as well, right?
Yeah.
So sympathetic nervous system, parasympathetic. So there are different kinds of places where the nerves go. So
see, basically, I think one thing you understand is the brain has different areas. Okay, just like we have in our globe, you have Russia, you have US, and so each particular area has a particular function.
Yeah. Okay.
Okay. So depending on which area the stroke happens, in the sense which area the blood flow is affected, that particular function is lost.
So it's not necessary that only the motor functions will be lost.
Not necessary.
Not necessary at all.
Yeah, that's the reason why this be fast sometimes can be a little bit misleading, because you may say, oh, now it's only sensory symptoms. As in, a person can have sensory symptoms as well.
Okay.
Okay, that numbness can be there and all that. Okay. So that can also be a symptom of stroke.
Yeah.
Okay, then you shouldn't ignore that. But this has been created because in general, like 95% of the times, these are the things which happen. That is the reason why we promote that, so that we shouldn't miss out on that.
Right. Okay. So you're basically covering 95% of the cases, but there is still a chance that without any of these symptoms, there could still be a stroke.
Yes.
Okay. So who is at the most risk of this? Is it like, so we did speak about genetic predisposition, people with a lot of stress, people who have hypertension, blood glucose abnormalities. These people are definitely at risk, but is it necessary that all of these people do keep screening for them, or is there a particular age or something after which it happens?
Yeah, I think it's very important that, again, there are guidelines for that, surely. I'm not very clear about it, but if you ask a neurologist, he'll be able to tell you in a more clear fashion about the exact time in which. But having said that, I guess if you have a family history in which you have a person who had a stroke, not just a stroke, if it could be even a heart attack, then probably a periodical checkup of your vasculature, the blood vasculature. Okay, not necessarily only the brain, because a stroke can happen even if there is a cardiac problem also.
Okay, yeah, because if the heart fails to pump to the brain,
So it is important to check your heart and the neck vasculature to periodically you need to get it checked. Okay, there's something called as an angiogram. Okay, CT angiogram. So you can get it done periodically. So periodically, again, it can vary.
Based on case to case.
Case to case, annually you can get it checked. But having said that, this misinformation, as in this is kind of say if you get a CT angio done and then you find that your blood vessels are normal, okay, they're functioning well, that doesn't make you stroke proof. Or that doesn't make you heart attack proof. Okay. Why? Because see that CT angiogram or even the blood investigations are only giving you a indirect understanding that okay, the blood is flowing normally through that tube. Is it telling you about the strength of your musculature or the blood vessel wall thick strength? No, it's not telling you anything about it.
Correct.
Okay. Correct. So what happens is if you keep having done a CT angio and then you say, now our CT angio is fine and I can do whatever I want, and then you splurge, you smoke, or you get into a brawl with something, and then for some reason, the wall it breaks or ruptures, you're done. So that's some kind of a misunderstanding in general population, that if you do a CT angio or get a heart checkup done, that kind of proves you, it makes you stroke proof or a heart attack proof. That is wrong. So trying to inculcate more basic personality changes, as in trying to be calm in whichever situation you can be, getting a good night's rest, okay, will fetch you much more benefits than just getting CT angiograms or carotid angiograms, all those things. Cardiac angiograms and all that. So this is it's more of a misunderstanding by the public, and somewhere even the medical fraternity is not, I can say, promoting this information, because what will happen is, then the public will say, then what's the point of getting an angiogram done? Isn't it? So that's the next question the public will ask.
Correct, because we'd like to take shortcuts, shortcuts in thought.
What's the point of getting an angiogram done? There's no need to get an angiogram. So that's where what will happen is, say a person has a diseased vessel, blood vessel, that will get missed.
Correct, because the angiogram isn't done.
So that is the reason why. So sometimes misinterpretation gets very rampant, everyone tries to misinterpret other things.
No, to be honest, I also had that question just now when you were telling that, getting an angiogram doesn't stroke proof you. So then I was like, why should then I get an angiogram? But then that's a good point that, if there is something
that can be diagnosed and that can be treated
immediately. Yeah, right.
That
so you put them on blood thinners or whatever, the necessary treatment is.
So that is the idea behind getting
so it's not, but anyway, let's not dwell on that, but
and the other thing what I say is this especially the stroke, we were always talking about in the whole discussion, we were always talking about the blood flow not flowing to a particular organ. There's another entity of stroke which is called a hemorrhagic stroke, where the blood vessel opens up. See, now we talked about the ulcer getting injured inside and then causing a clot inside. Okay, but the blood vessel also can open up outside, and then blood can flow out of the organ into the skull. So that's called a hemorrhagic stroke. That also was a stroke, and that also equally devastating. Okay. So either of that can happen. Now say by an angiogram, you can prove, you can at least get to know that there is a blockage or there's some kind of blockage there which can be treated.
Yeah, but you also said there was a term, aneurysm. Yes, aneurysm.
So aneurysms can be checked, okay, with an angiogram, but there is another entity, okay, where you won't have an aneurysm, but still you can bleed.
Oh.
Yeah, okay. So what happened there is, you'll have these smaller arteries, very fine arteries, okay, which you can't, which if there is an abnormality, you can't detect it. Okay, or that is very insignificant, you'll not be able to see it in your investigation, because what you see is a small picture. Okay, and those arterioles, okay, can open up and then can cause severe bleeding. That commonly seen in hypertension, that is BP, high BP, you see that. Okay, so a person who's generally having BP and has for some reason either ignored the medication or again has predisposed himself to a very high risk, too much of stressful activity, which will increase the BP further again, and then causing this kind of opening up of the smaller arteries, which you can't detect. So in essence, when you talk like this, in essence, more than anything, it's the paradigm shift in your personality and lifestyle is the most important thing to avert any major strokes or heart attacks.
Got it. Could save us from a lot of trouble, but
Not just stroke or heart attack, but other things as well.
Yes. Yeah. Nice. Okay. So I think with this, we'll wind up this episode and meet again, because every discussion that we have brings up a lot more questions. But then if we keep talking, people are going to, stop watching us.
There's no humor angle to this as well. They're all serious topics.
Yeah. True that. Yeah. but very informative. Thank you for your time also, doctor. And keep watching us. If you like this episode, go hit that like button. Subscribe to us to get more such, follow us, subscribe us and follow us for more such videos. And if you would like to be notified when a new video is uploaded, go hit that bell icon so that you get a notification. Other than that, please feel free to share your feedback in the comments below. Negative, positive, absolutely no problem. Just be nice, probably, because we are very new to this. So, but other than that, thank you for watching and you have a fantastic rest of your day. My paunch is not seen, no?
I'm trying to fix
It's a sign that I'm approaching middle age, Right, no, I'm working on that. So.
How old are you guys?
I am 35, these two are 32.
Then he has 45. This is middle age.
See, no, you have a license to have a paunch, okay? I don't. I don't qualify for it, so I have to hide. Alright, okay, so let's go live in 3, 2, 1. Hey everybody, welcome to this, the third episode, fourth, sorry.
this. Last week we go 3 take.
That's okay.
Retake. Hey everyone, welcome to the fourth episode. What's wrong with me? Okay,
Be casual. No?
Yeah, that's the problem.
That's why. It's okay. I mean, anyhow, you can always
No one else
Cut.
know. We have to be there.
cut and paste.
அதனால பிரச்சனையே. If I wanna, so it works the other way around for me. When I have like 1,000 people in front of me, I don't make mistakes at all somehow. But when I'm,
We'll look to this side. You people. No, we'll look. हम लोग ऐसे देखते हैं.
But when cameras are there, no, there is something changing in the environment that makes you think.
When I had this performance anxiety, a lot actually, I really had it. Even though I have it sometimes, suddenly it just comes in. Especially when you think that okay, the audience is much more knowledgeable than you, then you start feeling that. It's okay if you're say juniors and all that. So it has happened, but then in that sense, if you're very pakka about what your ideas and beliefs are, I think
we can talk.
We can shoot anybody.
Cool. Hey.